Okay, hello, good morning everybody. I'm so happy that you are all here. If I do not know you already, my name is Madison and I'm a graduating senior in the psychology department here. And back last month, actually, was it this one? Yeah, last month I got the opportunity to present some research that I've been doing over the course of the past academic year about therapeutic AI. So, because we're already a couple minutes late, I'll just go ahead and get into it. So first, I'm going to start just a little bit of like the background as to how we got here. So as artificial intelligence continues to advance, one thing that kind of gets forgotten about a little bit is the psychological factors that are what influence the way people perceive AI, particularly in therapeutic contexts and environments. And so to start bridging that gap, what we did in this study was look at how connection, engagement, feeling understood, and distress reduction all influence the way that people actually perceive therapeutic AI, so it's pretty cool. And like I said earlier, I'm pretty sure I don't have to tell any of y'all, but AI is like changing every day. It feels like every single day there's a new chatbot or something else going on into it. And that has also been going into the side of mental health therapy as well, and that one is even more new, and it's been developing a lot, especially over the course of the past year. But with this, there is still some concerns about AI's ability to replicate things that are essential components of therapeutic outcomes, which is things like empathy, connection, and emotional understanding, because without those things, psychotherapy is just not as effective. And while I was actually doing my literature review for this, I did find that AI is actually pretty good at developing like structured interventions, but overall, human therapists are who excel in fostering the deeper emotional connections that provide a more nuanced understanding of their clients' emotions and therefore lead to better outcomes. That was from Wang and Lee, published just last year. And so what we did in this study was try to explore these differences by examining factors that influence the way that people perceive therapeutic AI. All right, so just really quickly, I'll go over the specific variables that or the specific components more so that we looked at that we found that influenced therapeutic AI the most. The first one was connection. We examined whether individuals felt a stronger sense of connection with either an AI or with a human. We looked at levels of engagement. So we looked at how engagement differed between the groups. We looked at feelings of being understood, and so we explored whether participants reduced greater feelings of being understood with either the therapeutic AI or with the human. And the last thing we looked at was their reduction in distress, and so we once again compared the two groups and looked at which group felt a greater reduction in their distress. All right, so we recruited participants from a small private university in North Texas. You'll never guess where it was. We randomly assigned the participants to have either a short conversation with a therapeutic AI chatbot or with a person that was utilizing therapeutic skills. And just to kind of balance the two groups, both the AI and the person were utilizing person-centered therapy skills for the psychology people in here. And the conversation was then followed by a survey measuring their levels of connection, engagement, distress reduction, everything that we just talked about in the last slide. And also something that we were interested in and that I'll get into a little bit later was we threw in some questions from the ACME and the Big Five to look at participants' levels of empathy and conscientiousness because we had some hypotheses, and we did also measure their levels of social support, but yeah, we won't get into that. Okay, so for the data, we conducted independent samples t-tests between the two groups. And so if you're not very statistic-y, I can explain this pretty simply. So we found that participants felt greater levels of connection and feeling understood when they were speaking to the human therapist as opposed to the AI. We did find statistical significance with that. We found approaching levels of significance in the other two variables, which would be engagement and stress reduction. We weren't quite there, but this data is short term, it's not longitudinal, and it was from only just one conversation with either the AI or the person. And then I thought it'd be, just because we did find a little bit of interesting things, because we did also measure AI attitudes, like how positive or negative that people felt towards AI as well. And we did also measure their levels of cognitive and affective empathy. as well as their levels of conscientiousness. In case you don't know, cognitive empathy is your ability to basically logically understand why a person feels the way they do. Affective empathy is the ability to really put yourself in somebody else's shoes and feel what they're feeling. So like, for example, if Kelvin were to start crying in front of me right now, because I have quite a bit of affective empathy, I'd also probably start crying. So that's basically the difference between cognitive and affective empathy. Because I originally hypothesized that people with higher levels of affective empathy were going to have a way more negative reaction towards the AI. And we did find statistical significance that they reported lower levels of their thoughts and feelings being accurately acknowledged. So that's interesting. And I don't have a whole lot to say about this because I haven't been able to look super deeply into it so far. And we did also find, and those participants also specifically were in the AI group, not in the human group. And also in the AI group, there was some statistical significance with feeling found between having a more positive attitude towards AI and feeling more engaged and acknowledged emotionally. So it could be another potential area for future research possibly. All right, so to sum it all up, because I feel like I've thrown a lot of information, with the current data and literature that we have available right now in 2025, it does appear that therapeutic AI is not able to replicate the essential empathy and emotional depth that is essential for positive attitudes and positive therapeutic outcomes. And it is very possible that attitudes towards artificial intelligence and individual levels of empathy, specifically affective empathy, likely play some role, I mean, that's my hypothesis, take it or leave it, in the way that AI is individually perceived. And I do think that this could be an area for further research possibly. Unfortunately, like all studies, this does come with some limitations. So participants were all college students and primarily psychology majors at a small university. And this could have also impacted our sampling too, because it is known that a college education tends to increase your levels of conscientiousness and agreeableness, which also happen to be the two most common statistical factors that influence your attitudes towards AI. And this data was also short-term, and it was only from one conversation. We don't currently have any long-term or longitudinal data, but that is something that I would like to explore further, possibly for a next study. There was references on the slides, I promise, but at this time, if anybody has any questions, I would love to answer.
I have one.
Yes.
Would you consider maybe if you do further research, maybe using other majors outside of psychology?
That would be ideal. We did manage to get a couple non-psychology majors, but ideally I would like to do this across all majors and possibly outside of college and different age groups as well. Okay. Luckily, because Texas Wesleyan is pretty diverse, the age group was pretty diverse, and so was the ethnic diversity and everything, so that was one positive.
Did you find a fear in the folks that were in the AI group of Big Brother watching them because of the AI?
No, it was. I did make sure that they knew everything was confidential, and they were in a room by themselves, and I had all the memory features turned off, so none that I observed, but I hope not.
Okay.
All right, Eileen?
Yes, I want to ask you, why did you draw a conclusion based on one conclusion when it can be misleading?
So this conclusion was just from this study and the data that we had available. And so like I said, this is the data that we have right now at this moment in 2025. I don't necessarily think it's misleading because AI, and this isn't the only study that does show that AI is not really able to replicate empathy that's essential for therapeutic outcomes. And there also is currently a dearth of research too when it comes to psychological factors influencing therapeutic AI. So, does that answer your question?
Yeah.
Are you sure?
Yes.
Okay. Kelvin?
Do you think people's or the growing attitude towards AI can change people's negative attitude towards therapy in general, or interpersonal conversations kind of?
Yeah, so are you asking if as attitudes towards AI change, then attitudes towards therapy might also change? Or?
Yeah, because with AI comes the AI therapists and stuff, and I see a lot of that nowadays.
that is actually a really good question. I don't quite know that I have an answer to that right now, but I do think from other studies and also from some of the data in this study, I do think it appears that the way people feel about AI does make some sort of difference in the way that then they interact with the AI. I don't have any definite data to back that up, but I would hypothesize that.
I have a follow-up question.
Okay.
Might not be able to, it's just like hypothetical.
Mhm.
Do you think there's like a chance that like AI, and it's not like I'm hoping for this or anything, like the AI like could like maybe replace like people in like this profession?
I was about to ask that same question.
So, I think at this moment at least, and this is data for right now, if you look at what people need in order to have a positive therapeutic outcome, which is they need to feel engaged with their therapist, they need to feel connected, they need to feel understood. So in other words, they need that essential component of empathy. They need to feel like their therapist like really is there and cares about them, which it appears from data that AI at this moment is not able to do. Is it possible in the future? I would still think it's unlikely, but for at least now, and I think probably for at least our lifetimes, we are safe. Yes.
How do you think the body language and tone of voice assisted in like, the understanding between participants and the people?
Mm-hmm. Right, yeah. So that is another thing that does sort of play into the empathy that I was talking about. So with the AI, I probably should also mention the AI was like a voice. It was just them having a voice, yeah. It was just them having a voice conversation. Body language is a huge teller. I mean, not even just in therapeutic conversations, but in any conversation you have, I mean, your body language does convey a lot. So with the AI not having that body language, that is probably a component that contributes to that gap that we have of empathy. But like in therapy in general, I mean, body language, tone, facial expression, all that is huge.
Sorry. So I had like a stint where I did like online therapy, like during COVID and stuff, you know,
Mm-hmm.
where I didn't necessarily see like a therapist in person,
Mm-hmm.
but it's kind of like just your voice. So I was wondering if you guys, and I know a lot of people do that kind of stuff.
Yeah.
I got family members that do
Like
that.
virtual therapy.
Yeah.
Yeah.
And there's like no like body language in that. Did you guys happen to like test that out as well as the in-person therapy, or was it just?
We did not. With the person therapy, it was them like in a room together. Virtual therapy would have been interesting, and maybe even, I'm not sure if it would have future outcomes. Dr. Hand might know more about that, possibly.
She's referring to me because I'm a therapist and
Yeah.
I see people virtually. Like maybe what you experienced, Kelvin, but mine where you do have video and audio. I've also done therapy in person. Now this is anecdotal, of course, but I have not seen, surprisingly, I have not seen a significant difference in outcomes in person versus online therapy, as in I've seen as positive outcomes with online therapy. But they see me, I see them, there's audio, it's a pretty seamless experience. This AI, you could hear the voice that you're talking to. It wasn't like you're chatting with type, right? You're talking, but it was disembodied, right? There was no picture, there was no video. It was like just a voice that you're talking to. So that might have, of course, affected things, right? But
Yeah.
there's no AI available that would give us an animated human yet. A few years
Yeah.
probably.
Yeah, because that was actually, whenever I was presenting this in Arkansas, that was a question that I got actually a lot. People were asking if they think it would have been different if I like actually had a face with the AI. Unfortunately, at this time, I had no way of making that, but I mean, it's possible, because I do think, like what you're talking about virtual therapy, part of the reason why it is generally the same like amount of effective is because there is still that facial expression. Because I mean, our facial expressions, like even our micro expressions, they do tell us a lot about a person and what they're feeling. So, yeah. Oh, yes, Chris.
This is a similar question to what Calvin asked earlier, but
Okay.
I'm curious, do you think that there's any potential that just ease of access to something like an AI therapist could could serve as like a stepping stone for people who are hesitant about
Mhm.
getting therapy?
Yeah, I definitely do think that it could have a positive implication in that because, like therapy, it's becoming more accessible generally, but there is still those people who might be too intimidated or scared to actually reach out and go pursue therapy. And I do think possibly for those people, this could be a good stepping stone. While I was doing my literature review for this, I did also find that the therapeutic AI could potentially be beneficial for like less acute mental health concerns. So that could also play into it. It could be a good stepping stone. So I would think so.
So AI is based on inputs put in, right?
Yes.
So again, having the folks to program it and allow it to have the responses could bake in a little bit more empathy, but it still is based on inputs in is output. So
Yeah.
if someone did happen to program the AI wrong, then it could cause more damage than fixing it. So it's that trust that the people inputting the information into the AI and then it assimilates and it comes up with answers.
Right.
I think is where we have to relieve some trust, and I don't know that human beings are knowing that they're talking to something that's programmed.
Yeah.
Can really, trust it as much. But it could be a stepping stone
Right.
if you trust the data that was put into it to foster a good result.
Right, yeah. And that does also kind of like start also a question I also got a lot when I was presenting this at SWPA was like how ethical could this be? Because I do think if like therapeutic AI, I mean like Kelvin asked earlier, if it really does start to like replace, which I highly doubt will happen, then I do think that does come with a little bit of an ethical headache. There's already been some ethical concerns with like AI being a note-taking tool for therapists because then the data is all in there and it kind of opens up a whole ethical gray area of like what is right and what not.
I'm gonna get you interrupted.
Yeah. Oh, sorry.
Yeah, we're about out of time.
Okay.
We wanted to get a picture of everyone before we head out, if that's
Yeah.
okay. All right. I'm picturing the picture.